Hi, and welcome back to Live Well with Dr. Mel. I'm Dr. Mel, a licensed physical therapist and holistic health coach. If you haven't yet subscribed to my channel, go ahead and click that subscribe button. You'll get access to all my free videos. In this video, we're going to go over strengthening and flexibility exercises for knee arthritis. These exercises are great for people who want to manage their knee arthritis symptoms now, as well as prepare anybody who is going for an upcoming knee replacement surgery. These exercises resemble the exercises you're going to do in the first 1 to 2 weeks right after your knee replacement surgery. It's so important to gain that muscle memory now. So let's get started. The first exercise is heel raises. So you're going to line up your feet shoulder width distance, keeping your toes pointed straight. And you're going to go up as high as you can, hold it for 3 seconds, and then lower back down. Don't get frustrated if you can't get as high as me. Just go as high as you possibly can and lower back down. This is going to provide blood flow and circulation before starting your knee range of motion and strengthening exercises. It also helps build the strength in your calf muscles. So what I would perform 3-second holds, 10 reps. After that, you're going to go into toe raises. You're going to lift your toes up as high as you can, hold it for 3 seconds, and lower back down. This has the opposite action of the calf. It helps stretch your calf muscles, your gastroc muscle, and also strengthens the front of your shins. A common mistake I see people make when they're doing this exercise is they stick their butt up to try to get their toes up. Keep your posture nice and straight. Shoulder blades back, head forward when you're doing this. Same prescription. 3-second holds at the top and repeat it 10 times. The next exercise is hip flexion. So make sure you have enough space between you and the chair or countertop, whatever you're using to hold on to allow for your knee to raise fully up. This is going to strengthen your quadricep muscle, as well as your hip flexor. Hold it for 3 to 5 seconds at the end range and lower back down. The pause at the top is really important because that's where you get all the strength. If you can't get as high as me, don't get concerned. You'll get higher and higher as you keep performing this exercise. I would do 10 reps, 3 to 5 second holds at the top. Make sure you do the other side too. Because even as you raise the good side, you're working all the muscles on your involved side. You're stabilizing your quadricep and hip flexor here. If this is really difficult for you because you're in the later stages of knee arthritis and you're in a lot of pain, you have the chair and countertop here. Lean on it as you need it. Eventually, as this gets stronger, you won't have to lean so much, and you'll be able to stand up straighter and put less pressure through the countertop or chair. The next exercise is a hamstring curl. So this time I want you nice and close to the chair. You're going to bend the knee, bringing the heel up towards your butt. It's completely normal to feel a slight cramp in the back of the thigh. We don't work this muscle a lot, so you can feel a pretty intense cramp in the back of the thigh. Don't get alarmed. Once you relax, it will go away. And as you continue to do this exercise, it won't be so intense. So same thing, when you bend the knee, bring it as high as you possibly can, hold it for 3 to 5 seconds, and lower back down. A common mistake I see people make when they're doing this exercise is they bring their knee forward and bend the knee. You want to make sure you keep both your legs in the same alignment. You don't want the knee coming too far forward, because you want to make sure you're getting a nice stretch in the front of that hip flexor and quadricep muscle. So make sure your knees are in the same alignment. So same prescription, hold for 3 to 5 seconds and repeat 10 times. And make sure you do it on the other side, because it's going to work the standing balance on your involved side. So the next exercise is a heel slide. You may want to pop your shoe off for this exercise, because it's easier to slide the foot without tread on the bottom of your foot. It's easier to slide with the sock. And it would be easier actually on the wood rather than the carpet. So that might make it easier for you too if this is causing some difficulty. So now you're just going to slide your foot back as far as you can, hold for 5 seconds at your end range, and then bring it back out. If you're not getting the foot back as far as me, don't get concerned. It will get better in time. Just go to the point where you feel resistance, hold it for 5 seconds, and then bring it back out. And each time you just try to go a little further, till eventually that foot can come completely under the chair. I would perform this 10 times, 5-second holds. And the more often you do it, the better. You can do it 2 to 3 times a day. The next exercise is knee extension. So sit all the way back in the chair, and you're just going to kick the foot up, straightening the knee, flexing the toe towards you. Squeeze the top of that thigh. Flex the toe towards you, press that heel away, straighten the knee, straighten the knee, straighten the knee, and then lower back down. So you're trying to get full knee extension, getting the knee as straight as you can. By flexing the toe towards you, you're getting a little stretch in the back of the calf muscle as well. Same thing here. Hold it at the top for 3 to 5 seconds, and then lower back down. I would repeat this 10 times. You're really strengthening your quadricep muscle here. The next exercise is a quadricep. So grab a towel roll or a pillow and place it right underneath your ankle. This will allow you to have some space between the back of your knee and the floor. You don't have to perform this exercise on the floor. You can do it on your bed or the sofa if it's too difficult for you to get on and off the floor. That's fine. So now you're just going to press down into the towel roll, straightening the knee, contracting your quadricep muscle, flexing the toe towards you. You're going to hold it for 5 seconds and then release. I want you to repeat this 10 times. This is going to strengthen your quadricep muscle and allow for full knee extension. It's important to get the knee completely straight, because if you can't get your knee completely straight, that's when you can see people having a slight limp in their walking pattern. Because at heel strike, when you're walking, you want your knee completely straight so you'll never have a limp. So perform 5-second holds, squeezing the thigh muscle, getting the knee as straight as you can, and I would repeat this 10 times. The last exercise is a heel slide. You're probably going to want to remove your shoe for this exercise so you can allow the heel to slide more easily. Also, grab a strap. If you don't have a yoga strap like I do, you can use a pants belt or even a dog leash works. Place it right underneath your foot, and then you're gonna slide your heel up towards your butt as far as you can, pulling with the strap to allow you to get a little bit more range, a little bit more range. When you get to your end range, hold it for 5 seconds and lower back down. If you can't get it as far as me, don't worry. You may start just here. That's fine. Go to that point where you feel the stretch. Hold it for 5 seconds and then straighten back out. Each time you're going to get a little bit further, a little bit further. The more flexible your muscles are in the quadricep, the less pressure you're going to have at your knee. It's also important to stretch all the ligaments surrounding the knee joint so it moves nice and fluid. So this stretch is really important to help provide space and comfort at the knee joint and eases the pain from knee arthritis. Also, after you get knee surgery, this exercise is really tough because the quad gets really tight after the knee surgery. So it's very important to get good flexibility in your knee joint before you have surgery. And if you already had surgery, this is a great exercise to allow you to get flexibility back in the knee post-op. So same thing, 5-second holds at your end range and repeat this 10 times. Thank you so much for watching my video. If you enjoyed the content, please subscribe. I love when my viewers subscribe. If you have knee arthritis, I hope this helps manage your symptoms. And if you have an upcoming knee replacement or have undergone knee replacement surgery, I wish you all the best in your recovery and healing journey. Stay healthy, be well, and take care.